Hey everyone, Dr. Morales again. Taking it solo this time, but we have a very interesting topic today, and that is massive weight loss and contouring. So when people lose a lot of weight for whatever reason, um, one of the side effects, if you consider side effects, it's actually a consequence, is that you end up all this extra skin. The volume of having all that fat under your skin and then just deflating, this is what happens. You get extra skin of different parts of your body. And it depends on what part of your body you have, you carry a lot of weight in. Some people just are very bottom heavy, some are more heavy chested, some are just kind of wear like a big bodysuit overall. So plastic surgery, this is very commonly encountered with people who've had gastric surgery, either gastric sleeve or gastric bypass, or I've had a lot of people actually who just got on just said, I'm just done. I'm done feeling this big. I'm done with this lifestyle. I'm gonna change my lifestyle. I'm gonna live fit, eat right, exercise, and they've lost hundreds of pounds. I just had a lady last week we did surgery with, massive weight loss, lost 150 pounds, just incredible. Just diet and exercise, just having a better lifestyle, which I'm a huge fan of. So, and the consequence of that, she had extra skin on her, basically her entire body. And so eventually I'm gonna address all these aspects of her body, her arms, her thighs, her abdomen, her breasts, her upper back, eventually her neck. But we kind of take them in kind of pieces. Probably one of the most common areas of extra skin that I'm seeing more often is arms. Women don't like doing this and having this extra skin kind of flop around. So there is no diet and exercise to make that skin go away. It's just, I gotta take it off. You gotta cut it off. There's no other way around it. So, this is, I have an example on my website. This is a kind of an extreme example of how much skin that this lady had. Just a lot of skin. It starts kind of from her elbow, goes all the way to her armpit, and this is the after result. But it can be pretty profound, not in just, holding her arm out, but just to her side, you can see like the dramatic fullness and the hang of the extra skin of her entire arm. And now she's able to wear like shirts and not be self-conscious of her arms hanging out. The scars for these surgeries, there's a scar, the best way you can hide it is really kind of place it along seams. Typically you see it in like suits. And so for me, I put mine on on the bottom part of the arm. So you don't see your arms are out. When you raise your arms, you don't see the scar. And when you put your arms down, you don't see it as well. When you go like this, you don't see it. Give somebody a hug, you don't see it. The only time you see that scar is actually if someone's directly behind you and your arms are down. It's the only time you see that scar. So the surgery is actually very quick recovery. It's not as uncomfortable as you think it might be. Swelling is typically not, nothing out of control. Your hands won't get too puffy or anything like that. The recovery for that typically is around like maybe 3 to 5 days. Most patients are back to work. Just for arm surgery specifically, usually at 5 days you're back to work. So high satisfaction rate, huge change in their contours, and I've been able to help a lot of people with this, and very thankful to be part of their kind of transformation after massive weight loss and changes their lifestyle. So if you have any questions on arm lift, also called a brachioplasty, give me a call, talk to Linda about it, and I'd love to see you about it. Thank you.